Hi dear friends, welcome to Medical Destiny YouTube channel. Before watching this video, please take a moment to subscribe my channel. In this video, you will go through 25 Nclex-Rn nursing examination multiple choice questions and answers. Read the question by yourself.
381. The nurse provides information to a client with diabetes mellitus who is taking insulin about the signs of hypoglycemia. Which of the following signs should the nurse include in the information? Select all that apply. 1. Hunger. 2. Sweating. 3. Weakness. 4. Nervousness. 5. Cool clammy skin. 6. Increased urinary output. Answer: 1, 2, 3, 4, 5. Rationale: hypoglycemia is characterized by a blood glucose level less than 70 mg/dl. Clinical manifestations of hypoglycemia include cool clammy skin, hunger, weakness, sweating, nervousness, blurred vision or double vision, tachycardia, and palpitations. Increased urinary output is a manifestation of hypoglycemia. 382. The ambulatory care nurse is assessing a client with chronic sinusitis. The nurse determines that which manifestations reported by the client are related to this problem. Select all that apply. 1. Anosmia. 2. Chronic cough. 3. Nasal stuffiness. 4. Purulent nasal discharge. 5. Headache that worsens in the evening. Answer: 1, 2, 3, 4. Rationale: chronic sinusitis is characterized by persistent purulent nasal discharge, a chronic cough resulting from nasal discharge, anosmia, loss of smell, nasal stuffiness, and headache that is worse upon arising after sleep. 383. A client is diagnosed with hypothyroidism. The nurse performs an assessment on the client, expecting to note which findings. Select all that apply. 1. Weight loss. 2. Bradycardia. 3. Hypertension. 4. Dry, scaly skin. 5. Heat intolerance. 6. Decreased body temperature. Answer: 2, 3, 4, 6. Rationale: the manifestations of hypothyroidism are the result of decreased metabolism from low levels of thyroid hormones. Some of these manifestations are cool, dry, scaly skin, dry, coarse, brittle hair, decreased hair growth, bradycardia, hypertension, decreased body temperature, cold intolerance, slowing of intellectual functioning, lethargy, weight gain, and constipation. 384. A client is diagnosed with diabetes insipidus. The nurse performs an assessment on the client and expects to note which of the following. Select all that apply. 1. Bradycardia. 2. Hypertension. 3. Poor skin turgor. 4. Increased urinary output. 5. Dry mucous membranes. 6. Decreased pulse pressure. Answer: 3, 4, 5, 6. Rationale: diabetes insipidus is a water metabolism problem caused by an antidiuretic hormone, ADH, deficiency, either a decrease in ADH synthesis or an inability of the kidneys to respond to ADH. Clinical manifestations include tachycardia, hypertension, poor skin turgor, increased urinary output, dry mucous membranes, decreased pulse pressure, weak peripheral pulses, and increased thirst. 385. A client with pneumonia has anorexia caused by the effort required for eating while dyspneic and decreased taste sensation. Which of the following actions by the nurse would be most helpful in increasing the client's appetite? 1. Keep fresh water at the bedside. 2. Provide 3 large meals daily. 3. Provide mouth care before meals. 4. Encourage drinking fluids up to 3 liters per day. Answer: 3. Rationale: the client with pneumonia may experience decreased taste sensation as a result of sputum expectoration. To minimize this adverse effect, the nurse should provide oral hygiene before meals. The client should also have small, frequent meals because of dyspnea. increased oral fluids and keeping water at the bedside are good measures to prevent fluid deficit associated with pneumonia, but they do nothing to alleviate anorexia. 386. The clinic nurse notes that a large number of clients whose chief complaint is the presence of flu-like symptoms are being seen in the clinic. Which of the following recommendations should the nurse provide to these clients? Select all that apply. 1. Get plenty of rest. 2. Increase intake of liquids. 3. Get a flu shot immediately. 4. Take antipyretics for fever. 5. Eat a well-balanced diet with nutritious foods. Answer: 1, 2, 4, 5. Rationale: immunizations against influenza are a prophylactic measure and are not used to treat flu symptoms. Treatment for the flu includes getting rest, drinking fluids, and taking in nutritious foods and beverages. Medications such as antipyretics and analgesics may also be used for symptom management. 387. The nurse instructs a client with chronic pancreatitis about measures to prevent its exacerbation and provides which information to the client? Select all that apply. 1. Eat bland foods. 2. Avoid alcohol ingestion. 3. Avoid cigarette smoking. 4. Avoid caffeinated beverages. 5. Eat small meals and snacks high in calories. 6. Eat high-fat, low-protein, high-carbohydrate meals. Answer: 1, 2, 3, 4, 5. Rationale: chronic pancreatitis is a progressive, destructive disease of the pancreas, characterized by remissions and exacerbations, recurrence. Measures to prevent an exacerbation include eating bland, low-fat, high-protein, moderate carbohydrate meals and eating small meals and snacks high in calories, avoiding caffeinated beverages, alcohol ingestion, and nicotine, and avoiding gastric stimulants such as spices. 389. A client is diagnosed with cholecystitis. The nurse reviews the client's medical record, expecting to note documentation of which manifestations of this disorder. Select all that apply. 1. Dyspepsia. 2. Dark stools. 3. Light-colored and clear urine. 4. Feelings of abdominal fullness. 5. Rebound tenderness in the abdomen. 6. Upper abdominal pain that radiates to the right shoulder. Answer: 1, 4, 5, 6. Rationale: cholecystitis is an inflammation of the gallbladder. Manifestations include upper abdominal pain or discomfort that can radiate to the right shoulder, pain triggered by a high-fat meal, anorexia, nausea, and vomiting, dyspepsia, irritation, flatulence, feelings of abdominal fullness, rebound tenderness, Blumberg's sign, fever, jaundice, and clay-colored stools, dark urine, and possible steatorrhea. 390. A client is experiencing pulmonary edema as an exacerbation of chronic left-sided heart failure. The nurse assesses the client for which of the following manifestations? 1. Weight loss. 2. Bilateral crackles. 3. Distended neck veins. 4. Peripheral pitting edema. Answer: 2. Rationale: the client with pulmonary edema presents primarily with symptoms that are respiratory in nature, because the blood flow is stagnant in the lungs, which lie behind the left side of the heart from a circulatory standpoint. The client would experience weight gain from fluid retention, not weight loss. Distended neck veins and peripheral pitting edema are classic signs of right-sided heart failure. 391. A client begins to experience a tonic-clonic seizure. The nurse should take which of the following actions? Select all that apply. 1. Restrain the client. 2. Turn the client to the side. 3. Maintain the client's airway. 4. Place a padded tongue blade into the client's mouth. 5. Loosen any restrictive clothing that the client is wearing. 6. Protect the client from injury, and guide the client's movements. Answer: 2, 3, 5, 6. Rationale: precautions are taken to prevent a client from sustaining injury during a seizure. The nurse would maintain the client's airway and turn the client to the side. The nurse would also protect the client from injury, guide the client's movements, and loosen any restrictive clothing. Restraints are never used because they could injure the client during the seizure. A padded tongue blade or any other object is never placed into the client's mouth after a seizure begins because the jaw may clench down. 392. A nurse is monitoring a client diagnosed with a ruptured appendix for signs of peritonitis and assesses for which of the following? Select all that apply. 1. Bradycardia. 2. Distended abdomen. 3. Subnormal temperature. 4. Rigid, board-like abdomen. 5. Diminished bowel sounds. 6. Inability to pass flatus or feces. Answer: 2, 4, 5, 6. Rationale: peritonitis is an acute inflammation of the visceral and parietal peritoneum, the endothelial lining of the abdominal cavity. Clinical manifestations include a rigid, board-like abdomen, abdominal pain, localized, poorly localized, or referred to the shoulder or thorax, distended abdomen, anorexia, nausea, and vomiting, diminished bowel sounds, inability to pass flatus or feces, rebound tenderness in the abdomen, high fever, tachycardia, dehydration from the high fever, decreased urinary output, hiccups, and possible compromise in respiratory status. 393. The nurse prepares to administer an intravenous 4 medication when the nurse notes that the medication is incompatible with the 4 solution. Which is the best intervention for the nurse to implement for safe medication administration? 1. Ask the provider to prescribe a compatible 4 solution. 2. Start a new 4 catheter for the incompatible medication. 3. Collaborate with the provider for a new administration route. 4. Flush tubing before and after administering the medication with normal saline. Answer: 4. Rationale: when giving a medication intravenously, if the medication is incompatible with the 4 solution, the tubing is flushed before and after the medication with infusions of normal saline to prevent inline precipitation of the incompatible agents. Starting a new 4, changing the solution, or changing the administration route are unnecessary because a simpler, less risky, viable option exists. 394. A nurse is preparing to administer eardrops to an infant. The nurse plans to 1. Pull down and back on the auricle and direct the solution onto the eardrum. 2. Pull up and back on the earlobe and direct the solution toward the wall of the ear canal. 3. Pull up and back on the auricle and direct the solution toward the wall of the ear canal. 4. Pull down and back on the earlobe and direct the solution toward the wall of the ear canal. Answer: 4. Rationale: the infant should be turned on the side with the affected ear uppermost. With the non-dominant hand, the nurse pulls down and back on the earlobe. The wrist of the dominant hand is rested on the infant's head. The medication is administered by aiming it at the wall of the ear canal rather than directly onto the eardrum. The infant should be held or positioned with the affected ear uppermost for 10 to 15 minutes to retain the solution. In the adult, the auricle is pulled up and back to straighten the auditory canal. 395. A client seeks treatment in an ambulatory clinic for a complaint of hoarseness that has persisted for 8 weeks. Based on the symptom, the nurse interprets that the client is at risk of having 1. Thyroid cancer, 2. Acute laryngitis, 3. Laryngeal cancer, 4. Bronchogenic cancer. Answer: 3. Rationale: hoarseness is a common early sign of laryngeal cancer, but not of bronchogenic or thyroid cancer. Hoarseness that persists for 8 weeks is not associated with an acute problem, such as laryngitis. 396. A client is admitted to the cardiac intensive care unit after coronary artery bypass graft surgery. The nurse notes that in the first hour after admission, the mediastinal chest tube drainage was 75 milliliters. During the second hour, the drainage has dropped to 5 milliliters. The nurse interprets that, 1. This is normal. 2. The tube may be occluded. 3. The lung has fully re-expanded. 4. The client needs to cough and deep breathe. Answer 2. Rationale: after coronary artery bypass graft surgery, chest tube drainage should not exceed 100 to 150 milliliters per hour during the first 2 hours post-operatively, and approximately 500 milliliters of drainage is expected in the first 24 hours after coronary artery bypass graft surgery. The sudden drop in drainage between the first and second hour indicates that the tube is possibly occluded and requires further assessment by the nurse. Options 1, 3, and 4 are incorrect interpretations. 397. The nurse is auscultating the chest of a client who was diagnosed with pleurisy 48 hours ago. The client does not have a pleural friction rub, which was auscultated the previous day. After verifying these data in the client's health record, the nurse interprets that this is most likely the result of 1. Effectiveness of medication therapy. 2. Deep breaths that the client is taking. 3. Decreased inflammatory reaction at the site. 4. Accumulation of pleural fluid in the inflamed area. Answer 4. Rationale: pleurisy is the inflammation of the visceral and parietal membranes. These membranes rub together during respiration and cause pain. Pleural friction rub is auscultated early in the course of pleurisy, before pleural fluid accumulates. Once fluid accumulates in the inflamed area, there is less friction between the visceral and parietal lung surfaces, and the pleural friction rub disappears. Options 1, 2, and 3 are incorrect interpretations. 398. The nurse provides information to a client with a colostomy about the foods that will help prevent odor from the colostomy and tells the client to consume which foods. Select all that apply. 1. Parsley. 2. Yogurt. 3. Buttermilk. 4. Cucumbers. 5. Cauliflower. 6. Cranberry juice. Answer 1, 2, 3, 6. Rationale: the nurse should provide information about foods and measures that will prevent odor from a colostomy. Parsley, yogurt, buttermilk, and cranberry juice will prevent odor. Charcoal filters, pouch deodorizers, or placement of a breath mint in the pouch will also eliminate odors. Foods that cause flatus and thus odor, including broccoli, Brussels sprouts, cabbage, cauliflower, cucumbers, mushrooms, and peas, should be avoided. 399. A client has frequent runs of ventricular tachycardia, and the physician prescribes flecainide, Tamboca. Because of the effects of the medications, the nurse should do which of the following? 1. Monitor the client's urinary output. 2. Assess the client for neurological problems. 3. Ensure that the bed rails remain in the up position. 4. Monitor the client's vital signs and ECG frequently. Answer 4. Rationale: flecainide is an antidysrhythmic medication that slows conduction and decreases excitability, conduction velocity, and automaticity. However, the nurse must monitor for the development of a new or worsening dysrhythmia. Options 1, 2, and 3 are components of standard care but are not specific to this medication. 400. The nurse provides information to a client with gastroesophageal reflux disease, GERD, about the factors that contribute to decreased lower esophageal sphincter, lay, pressure and worsen the condition. The nurse tells the client that which factors contribute to decreased lay pressure. Select all that apply. 1. Alcohol. 2. Fatty foods. 3. Citrus fruits. 4. Baked potatoes. 5. Caffeinated beverages. 6. Tomatoes and tomato products. Answer 1, 2, 3, 5, 6. Rationale: GERD occurs as a result of the backward flow, reflux, of gastrointestinal contents into the esophagus. The most common cause of GERD is inappropriate relaxation of the lay, which allows the reflux of gastric contents into the esophagus and exposes the esophageal mucosa to gastric contents. Factors that influence the tone and contractility of the lay and lower lay pressure include fatty foods, caffeinated beverages such as coffee, tea, and cola, chocolate, citrus fruits, tomatoes and tomato products, nicotine in cigarette smoke, calcium channel blockers, nitrates, anticholinergics, high levels of estrogen and progesterone, peppermint and spearmint, alcohol, and nasogastric tube placement. 401. A nurse is developing an educational session on client advocacy for the nursing staff. The nurse plans to tell the nursing staff that which of the following are examples of the nurse acting as a client advocate. Select all that apply. 1. Obtaining an informed consent for a surgical procedure. 2. Providing information necessary for a client to make informed decisions. 3. Providing assistance in asserting the client's human and legal rights if the need arises. 4. Telling a client that he or she will need to defend himself or herself about healthcare rights. 5. Ignoring the client's religious or cultural beliefs when assisting the client in making an informed decision. 6. Defending the client's rights by speaking out against policies or actions that might endanger the client's well-being. Answer: 2, 3, 6. Rationale. In the role of client advocate, the nurse protects the client's human and legal rights and provides assistance in asserting those rights if the need arises. The nurse advocates for the client, keeping in mind the client's religion and culture. The nurse also defends clients' rights in a general way by speaking out against policies or actions that might endanger the client's well-being or conflict with his or her rights. Informed consent is part of the physician-client relationship. In most situations, obtaining clients' informed consent does not fall within the nursing duty. Even though the nurse assumes the responsibility for witnessing the client's signature on the consent form, the nurse does not legally assume the duty of obtaining informed consent. 402. A registered nurse, RN, is planning the assignments for the day and is leading a team composed of a licensed practical nurse, LPN, and a nursing assistant, NA. The nurse should assign which client to the LPN? 1. A client with dementia. 2. A one-day post-operative mastectomy client. 3. A client who requires some assistance with bathing. 4. A client who requires some assistance with ambulation. Answer: 2. Rationale. Assignment of tasks must be implemented based on the job description of the LPN and NA, the level of education and clinical competence, and state law. The one-day post-operative mastectomy client will need care that requires the skill of a licensed nurse. The nursing assistant has the skills to care for a client with dementia, a client who requires some assistance with bathing, and a client who requires some assistance with ambulation. 403. A nurse is planning client and unit activities for the day. Select the activities that the nurse should delegate to the nursing assistant. Select all that apply. 1. Deliver fresh water to clients. 2. Empty urine out of Foley bags. 3. Take temperatures, pulses, respirations, and blood pressures. 4. Count the substance control medications in the opioid medication supply. 5. Check the crash cart, cardiopulmonary resuscitation cart, for necessary supplies using a checklist. 6. Check all intravenous, 4, solution bags on clients receiving for therapy for the remaining amounts of solution in the bags. Answer: 1, 2, 3. Rationale. Delegation is the transfer of responsibility for the performance of an activity or task while retaining accountability for the outcome. When delegating an activity, the nurse must consider the educational preparation and experience of the individual. A nursing assistant is trained to perform non-invasive tasks and those that meet basic client needs. The nursing assistant is also trained to take vital signs. Therefore, the appropriate activities to assign to the nursing assistant would be to empty urine out of Foley bags, deliver fresh water to clients, and take temperatures, pulses, respirations, and blood pressures. Any activities related to medications and for therapy must be delegated to a licensed nurse. Although a nursing assistant is trained in performing cardiopulmonary resuscitation, he or she is not trained to check a crash cart, and this activity must be assigned to a licensed nurse. 404. A nurse is in the process of giving a client a bed bath. In the middle of the procedure, the unit secretary calls the nurse on the intercom to tell the nurse that there is an emergency phone call. The appropriate nursing action is to 1. Finish the bath before answering the phone call. 2. Immediately walk out of the client's room and answer the phone call. 3. Cover the client, place the call light within reach, and answer the phone call. 4. Leave the client's door open so the client can be monitored and the nurse can answer the phone call. Answer. 3. Rationale. Because the telephone call is an emergency, the nurse may need to answer it. The other appropriate action is to ask another nurse to accept the call. This, however, is not one of the options. To maintain privacy and safety, the nurse covers the client and places the call light within the client's reach. Additionally, the client's door should be closed or the room curtains pulled around the bailing area. 405. A nurse manager is reviewing with the nursing staff the purposes for applying wrist and ankle restraints, security devices, to a client. The nurse manager determines that further review is necessary when a nursing staff member states that an indication for the use of a restraint is to 1. Limit movement of a limb. 2. Keep the client in bed at night. 3. Prevent the violent client from injuring self and others. 4. Prevent the client from pulling out intravenous lines and catheters. Answer. 2. Rationale. Wrist and ankle restraints are devices used to limit the client's movement in situations when it is necessary to immobilize a limb. They are applied to prevent the client from injuring self or others, pulling out intravenous lines, catheters, or tubes, or removing dressings. Restraints also may be used to keep children still and from injuring themselves during treatments and diagnostic procedures. Restraints are not applied to keep a client in bed at night and should never be used as a form of punishment. A physician's prescription is required for the use of restraints and agency procedures are always followed when restraints are used.